Yeah, thank you.
All right, we're going live. All right, I think we're live right now. Hey, everybody, my name is Matt Ferry. I'm a candidate for State House here in Tennessee, District 48, which is the eastern half of Rutherford County. I'm joined today by Hope LaFever. Hopefully, I said that correct. And she is the chapter lead for T1 International, which is a group that advocates for folks who have diabetes and for lowering the cost of insulin. So, welcome today. Thank you so much for joining me, Hope. Tell me a little bit about T1 International.
Yeah, well, thank you so much for having me. Um, Again, my name is Hope. I am actually the chapter leader for the Tennessee chapter of T1 International. We are a global nonprofit organization run by patient advocates that advocate for insulin affordability. And what we do is we try to spread awareness, spread messages, and help to pass legislation for capping insulin prices. And so that is kind of my job in Tennessee. I'm trying to just make everybody more aware of the issue because I feel like the issue is not a lot of people are aware and we have to start somewhere. And so that's where I come in.
Yeah, absolutely. Well, I am not someone who's affected by diabetes, but I have lots of friends and family that are. My uncle actually recently had a stint in the hospital and he's doing much, much better. But that's where he found out that he had diabetes and he had to change his diet, his routine, everything. And of course, now he's having to inject insulin every day. So this was, I knew something about it, but I didn't really know just how many people this affects and how intense it is because you have to check your blood sugar pretty regularly. You have to be super careful about your diet, I'm pretty certain, maybe you can correct me if I'm wrong, that most people with diabetes have to inject insulin every single day. Is that true?
It depends on the diabetes.
Okay.
So for people with type 1, yes, we have to inject insulin. We are insulin dependent. And without insulin, we will die. There is no shortcuts around the corner. It's we have to have this or we will die.
Yeah, that's intense. That's not fun.
No.
And to my knowledge, the price of insulin, the people who created insulin supposedly wanted it, gave it away so that it would be, able to distribute it pretty cheaply. But at some point, Pfizer or Merrick or one of those companies got their hold on the patent for it and have jacked the price up just an insane amount. So tell me a little bit about that with the price increasing of insulin.
Yeah, sure. So in 1923, Sir Frederick Banting in Canada, along with a couple of his colleagues, invented insulin. And so they sold their patents of insulin to the University of Toronto, Canada for $1 each back then. And Frederick Banting um, was stated that insulin does not belong to me, it belongs to the world. And since then, since 1923 up until now, um, companies like Eli Lilly, Novo Nordisk, and Sanofi are 90%, they control 90% of the insulin market in the United States.
Wow.
So that's a pretty big number range. I mean,
Yeah.
they own most of the insulin that we all need to survive. And they hold a pretty tight grip on their patent. So that way, other companies cannot release generic versions of insulin to help lower the cost. And so, since the 90s, forgive me, I was born in the 90s, so I'm
Yeah.
not quite sure. I believe it was 98. I'll have to
Okay.
go back, double check that, but I believe it was 1998. A 3 milliliter bottle vial of insulin cost roughly $21 to produce and sell. That same exact vial now runs upwards of 330 or more. Same exact vial,
Wow.
no chemical changes, no packaging changes. It's still the exact same, still keeping us alive. But the issue is the price gouging of these pharmaceutical companies.
Right. So you're saying that just like a little bottle costs about $21 to make, and they're jacking up the price to $300 or more per vial. Eh,
Manufacturing cost, it runs roughly between $3 to $6 per vial.
uh-huh. Yeah.
That that is a huge markup increase.
Yes, it is.
T1 International actually did a study in, let me pull it up, Yale, let me see, Yale study, Yale News, excuse me, that 1 in 4 patients with diabetes, 25%, can't afford and access this critical medically needed supplies. And that's deadly. Some people will go without paying rent, go without getting groceries. And at the end of the day, you can't you can't pick one or another. We need this to live. And that's
Right.
kind of a big issue. And you know, with Congress, we are trying to pass an insulin list price cap in Tennessee. The SB 0522, presented by Senator Briggs, and HB 0451, presented by Senator Hodges. And so I think what they did was introduce this bill to the legislation. And at first, it was going to be the first of its kind. It was going to be a list price cap, which is what we all need. That is what we need federally, a federal list price cap. But what has since happened since its introduction in early 2021, I'm so sorry, is that it has been changed in wording
Mm,
from a list price cap now to a copay cap, which helps people with insurance, no doubt. It caps the mark at $100 a month for their insulin.
okay.
If you ask me, I still think that's too much,
Mm-hmm.
but it still has this margin of error for people that are underinsured or uninsured
Mm.
because we are still left at paying the list price cap.
Wow. And so because of this, because of the cost, people have died, right? People have
Yeah,
died because they can't afford to do it. And like you said, when you're in this position, it's either buy food, buy groceries for the week, or buy the vial. One or the other is going to, they're not, people are going to say, well, I can't afford this, so I'm just going to try to tough it out. But you can't just tough out diabetes. It is something that is with you for the rest of your life, and you need insulin. You need this insulin to live.
exactly. You're absolutely right. Alex Smith actually, he passed away in 2017, and he was found in his apartment alone after he had aged off of his mother's health insurance at age
Mhm.
26. And he was, I believe, he was 3 days short of his paycheck. And he was found alone in his house because he could not afford his insulin when he went to pick up at the pharmacy. And so, his mother, Nicole, she's a wonderful person. She advocates so hard for people like us. So this doesn't have to happen to anybody else. But I remember speaking with her, talking about this. And, that's something that you don't want to get a phone call for of anybody, of a friend, of a family member,
Right.
because it's life or death for people. And so it shouldn't have to be.
Right.
And so, because of that, there is an underground black market of insulin being
Wow.
distributed throughout the United States. Because if we distribute insulin, now T1 International, I'm not speaking on behalf of them right now.
Okay.
We are not allowed to distribute insulin
Hmm.
since we are a nonprofit organization, but individuals can distribute them, but it is illegal.
Hmm.
And so you run the risk of, am I going to go to jail for helping somebody stay alive? But
Right.
at the end of the day, take me to jail because that's absurd that we have to do this.
Mm-hmm. Oh yeah, no, it's absolutely absurd. And it's, I mean, it just, it's everything about this time right now. We have a healthcare system that profits off of the folks who have the least. Honestly, Tennessee is home to some of the biggest healthcare companies in the world, and frankly, they're not doing enough in Tennessee. Um, I believe I was telling you earlier about remote area medical. This guy who was an army doctor who retired and worked for Doctors Without Borders for years, flying into third world countries and setting up a little tent city for 2 weeks or so, and giving them all the medical help they could provide in that time period, and then flying out. Well, he retired and moved back to his hometown of Knoxville, Tennessee, and guess what he found? The exact same conditions were happening in East Tennessee and Appalachia and all across the South. So that's when he started remote area medical. I just thought I'd add that in. It's just kind of a fascinating story, but it's completely it should not be needed in this world where there's plenty of money for everyone. There should be plenty of access to quality healthcare for everyone. We live in a very greedy world, and this is part of it right now. Someone is profiting off of the misery of others, and literally the death of others. I'm actually looking at your site right now, T1 International, and I'm going to link that here in a second. But it says right here that since the 90s, the cost of insulin has increased over 1,200%. Yet the cost of production for a vial of analog insulin is between $3.69 and $6.16. It also says spending by patients with type 1 diabetes on insulin nearly doubled from 2012 to 2016, increasing from $2,900 to $5,700. I mean, that's huge. That's a huge amount of money. And then it says 1 out of 4 patients have died because of rationing insulin due to the cost. So that's very sad. And I'm glad to have met you, Hope. I'm glad that you're an advocate for this group. Tell me what you're working on next.
So right now I am working on um, moving forward with the Tennessee legislation. I know I told you last time we spoke that Marsha Blackburn had agreed to meet with um, us as the Tennessee chapter, but then shortly after she went and voted against the Insulin Act. And so I think that that really put a dent in us. So right now I am reaching out to local and federal legislators to just talk to them because this isn't a red or blue or left or right issue. This
Right.
is this affects people you know, people you love, and it's going to hurt them whether you vote for it or against it. And so
Right.
I think that we need Medicare for all. We need, in Tennessee specifically, Medicaid and Medicare expansion
Yes.
to help prevent this from happening to somebody that you love, somebody that you know,
Hmm.
because the statistics that you read about, those are people,
Yep.
and they're not, these people are dying, like, and they can't come back.
Right.
And so I think when we spoke last, you didn't really know much about this, but everybody knows somebody who is affected by this, whether they want to acknowledge that or not. But it is going to hurt them in the long run.
Yeah. Absolutely. No, this is a terrible thing. And again, there are people who are profiting off this, profiting off of the misery of others. And this is not a red or a blue issue, like you said. Senator Briggs, he's a Republican out of East Tennessee. House member Hodges, Jason Hodges, he's from Clarksville. He's a Democratic member. So it's great to see them working together on this. Unfortunately, I think both Jason Hodges and Richard Briggs are retiring after this term. So, hopefully there'll be some people in those spaces that are aware of this, but we need to help you, right? We need to go on this website today. Can we sign up and maybe what can we do to help?
If anything, you can just spread the message because nobody, I feel like nobody is aware of this until
Mhm.
I start to talk to people about this and they're like, "Oh my gosh, like I had no idea that this was such an issue." Because I feel like the American mentality is if it doesn't affect you, then it's not an issue.
Right.
But you can follow T1 International. You can follow T1 International itself, the organization, on Instagram. It's just at T1 International. And you can follow the Tennessee chapter. It is, I believe it's TN Insulin for All. I believe that's it. I'll have to double check.
Okay.
And you can follow us on Instagram and Twitter to keep up with what we are doing as a state chapter. I'm trying to host local meetups. Hopefully, I'll be able to do that in the month of November.
Okay. So we need people to sign up. We need people to support your efforts, to support this chapter. So you can go to this website. I did link this website. It's t1international.com/Tennessee. It's for the Tennessee chapter. And on here, you can find all the social media links. And you can also sign up. You can order a t-shirt as well that will go and help this organization. So we need to do everything that we can do for this particular issue, including finding some new legislators in the spring to take this up. So we talked a little bit about that. We're going to talk some more about it, and if we have to organize maybe a lobbying day, or if there's another organization that is doing that, maybe we can join ahead. I would love to do that and get in some legislators' offices and talk to them about this issue because, like you said, this is not a right or right or a left or a red or a blue issue, and this affects so many people that this is so important to push this issue and to try to get Tennessee to pass this in the next year because those costs keep on rising, and the more those costs rise, the more people are going to make a terrible, terrible choice, and their life is on the line because of that. So, if you're passionate about this issue, and I hope you are, please sign up today with Hope's group. She is part of the Tennessee chapter again of T1 International, and join us as we try to get some legislators on board for this in the springtime because this is what we're going to be working on. If I get elected, I will be pushing this issue. If I don't get elected, I will be pushing this issue because it's very, very important. And it's just wrong that we have left so many people behind on this particular issue and let some very, very, very wealthy companies profit off this. It's really disgusting what we have allowed some companies to do in this country. So anyway, I'm getting off my soapbox now, but Hope, do you want to tell us anything else about this group or your mission or anything else?
Yeah, absolutely. I have been an advocate for Insulin for All for about since I was 18. I turned 25 this year. I'm not good at math, but T1 International is a nonprofit organization run by patient advocates, and we do not accept any donations from pharmaceutical companies. And so I think that really sets us apart from organizations that you've heard of, like the American Diabetes Association and the Juvenile Diabetes Research Foundation. Or I'm sorry, I'm not good at acronyms.
Good.
But these organizations, they push for healthy lifestyles with diabetes, but behind the closed doors, they still accept funds from the exact companies that are hurting us.
Oh,
And so, just health is wealth, and knowledge is wealth. And the more people that know about this issue, I think we can help to push and make a better world than what we were given.
yeah,
That's
absolutely.
that's my goal.
Well, just one more question, real quick. Um, do you mind sharing your story? It sounded like you received this diagnosis back when you were 18. So what was that like, if you don't mind just sharing about that?
Yeah, sure. So I've been a diabetic since 2003. I was diagnosed when I was 5 years old,
Oh, wow. Okay.
and I lost my health insurance when I was 18. I was on the state Medicaid program, TennCare,
Mm,
and I didn't have anywhere to go. It was very scary as a young adult to not have any idea where you're gonna get the medication that you need to stay alive. I
right.
remember calling TennCare and crying on the phone, and they were like, "I'm sorry, there's nothing that we can do to help you." And, so for the last 7 years now, oh my gosh, I have been uninsured, and that is very, very hard in capitalist America,
Yeah.
where everything requires insurance,
Mhm.
and luckily, I'm still here. I'm still fighting my ass off. I don't know if I can say that on here, but
Yeah. Yes, you can. Yes.
I am just fighting for people like me who need this accessibility because I because of um, assisted programs and
Mhm.
people who send insulin through the mail. And while I am so forever grateful for that, that should not be the thing. That should not, we shouldn't have to do that to have to stay alive.
Right.
And what I've done is I take that fuel and that anger and I utilize that to hopefully inspire change in the state because I remember being so alone at 18 and I'm still here today though, so I think
Yeah.
that all of the all of the worries that I had to do really taught me how to be resourceful and how to keep going and be here today to help inspire other people and help them get what they need to stay alive.
Yes. Well, that's an incredible story, and it reminds me that anyone can become diabetic, and maybe that's because of poor diet or health choices. However, it's a freak thing. It can happen. It can just happen, even if you don't have a super unhealthy diet, and also it can help it happen to children. It's just a freak thing that can happen even as young as 5 years old. So this is an important issue that people need to get on board on. We need to cap the price of insulin, and hopefully we can do that with next year's legislative session. I'm looking forward to joining you for many more conversations about that, Hope, and hopefully we can grow your coalition. But it starts tonight. So, viewer out there, please go to this website down below and sign up and join the coalition to cap the insulin price because so many people are dependent on this. And to keep raising the price is just completely unconscionable. Um, but that's the world that we live in. But we're going to fight back against it, and we're going to grow our coalition, and we're going to cap the price of insulin. So if you're interested, please sign up today. Thank you so much, Hope, for coming on my little show here. I appreciate it, and I look forward to working with you in the near future.
Yeah, thank you so much for having me. I enjoyed letting you uh, be on my soapbox on your show. So thank you.
Yes. Thank you so much. All right. Well, that's going to be all for us today. But thank you for joining us. Again, we are not going to let this issue go by the wayside. We're going to sign up and join Hope's group today so that we can cap the price of insulin. Thank you, everyone, for watching, and I hope you have a good evening.